Your heart beating every second, every day of your life, 35 million times a year. Your body's most important muscle, keeping you healthy and active, as long as you do your part to keep it healthy. That's why Minnesota's Sage and SagePlus programs were created to help you stay healthy. Too many women don't pay attention to heart health. That's why cardiovascular diseases, disorders of the heart and blood vessels, are so common. Heart disease is the leading cause of death for American women, responsible for 1 in 5 female deaths every year. Stroke is another major cause of death. So what exactly is cardiovascular disease? It starts with a buildup of fatty deposits and blood clots in blood vessels. The blockage can cut off blood flow to the heart, causing chest pain or a heart attack, to the brain, causing a stroke, to the arms and legs, causing pain and disability. What causes heart disease? Family history definitely plays a role. If your parents or grandparents had heart disease, you could be at risk yourself. Our health is tied very closely to where we live, learn, work, and worship. Factors such as safe housing, transportation, education, income, access to healthy and affordable foods, and whether you experience racism or violence all contribute to your hypertension risk. Unfortunately, they are very difficult or impossible to control as individuals. But there are many causes we can control. Smoking raises the risk of heart disease. So does unhealthy diet and getting too little exercise. There are other causes we can try to influence. Obesity is a major risk factor. So is high cholesterol, diabetes too. And high blood pressure, also called hypertension, is the number 1 cause of cardiac disease and stroke. Hypertension is often called the silent killer because it has no symptoms but can lead to death. It's worth looking closely at a few things many women don't know about heart disease. Many don't realize what a serious threat it is. While most women know they should be screened for breast cancer and cervical cancer, it's worth remembering that heart disease is a much more common danger. Many women also don't know that heart disease affects men and women differently. While men have more heart attacks, women have more strokes. When women do have heart attacks, they often have unique symptoms: chest pressure or tightness instead of pain, unusual fatigue, shortness of breath, nausea, sweating, pain in the neck, back or jaw. Some racial and ethnic groups are impacted differently by heart disease and associated death. Communities of color, American Indians, and other marginalized communities are affected by structural racism, historical trauma, bias, and other barriers that may make it harder to access care and resources that support health. This means that people in some communities may be at greater risk of developing or dying from heart disease. In Minnesota in 2021, Black adults aged 35 to 64 died from heart disease at approximately 2 times the rate of all Minnesotans of the same age. From 2018 to 2021, the death rate of American Indians was 1.5 times higher than Minnesotans overall. Women also have unique symptoms when they have strokes. Like men, they often experience numbness in face, arm, or leg, trouble speaking or understanding, vision problems, trouble walking, severe headache without a known cause. And women having a stroke can also experience general weakness, confusion or memory problems, tiredness, nausea, or vomiting. What should you do if you have symptoms of a heart attack or a stroke? Call 911 right away or have someone else call. Ask for an ambulance. Getting to an emergency room quickly can save your life. Once you know the risks and the signs of heart disease, you'll be ready to act to prevent it. And there's so much you can do to reduce your risk. Get your blood pressure checked. If it's high, take the medicine your doctor prescribes. Get tested for diabetes. If you need medicine, take it. Get your cholesterol and triglycerides checked. If your doctor recommends medicine, take it. Don't smoke. If you need to quit, ask for help. Limit alcohol to 1 drink a day. Make healthy food choices to control your weight, blood sugar, and cholesterol. Get moving. Exercise for half an hour, 5 times a week. Breathe deep. Learn healthy ways to cope with stress. The journey to better heart health begins with many small steps, and you don't have to walk the path alone. The SagePlus program can help. While the SAGE program helps screen women for breast and cervical cancers, SagePlus is a sister program that helps women avoid other health problems, many of them related to heart disease. The program can pay for screening tests to measure your risk for cardiovascular disease. Tests check for diabetes, hypertension, obesity, and high cholesterol. And once you've been tested, SagePlus can help you get healthier with programs called Healthy Behavior Support Services. These services might include one-on-one talks with pharmacists, nutritionists, or diabetes educators. They may involve fun group exercise or nutrition classes. You can work with the staff at your clinic to choose the program that will help you the most. There you have it, a quick lesson in taking care of your heart. If you think about it, it's the surest way to take care of your family. They need you, and you need a healthy heart. SagePlus is here to help. Ask the staff at your clinic to get started.